Good afternoon. When I was invited to speak before a group of people interested in public health, it actually perked me up. Why? Because when I left when I left the Ministry of Health and become an advisor on some government offices, there was also a shift in policy. And there were a lot of things that I realized. When we were focused so much, as what Dr. Tikipang has said, increasing the budget, we realized that out there in the fields, in the islands, and even the legislators and the other major stakeholders when it comes to project prioritization, they didn't understand that vaccination is a very important aspect of public health. I wouldn't go through this. All of us are very much aware of how we have transcended into that era where vaccine was not yet available. And when it came and became available, and mind you, what is very important in this slide is this is something that the new generation and even the future generation might not realize anymore. Because when they were born into this world, they already forgot all the epidemics that affected them. So it's very important to now think of personalities in our individual countries. Because like when I reviewed, I realized that one of our greatest heroes conceptualized the revolutionary government. And the next day, which was actually the first day of the major war against the people who wanted to conquer the Philippines, he can't stand up. He was inflicted with polio. But the word was out that he was inflicted with herpes. And so he lost all these supporters. And after years, when he was already buried, they had to exhume his remains and really determine whether he had herpes or was it polio. It was polio, but by the time he was already dead. The question is immunization a program for the private or the public sector? Because much has been given to the focus of we have Zika. And people will say, oh, there's a new virus, and there's a new vaccine being developed for Zika. But when a vaccine is made available, the first question will always be its availability. There is not much talk being discussed about how important it is that a new vaccine should not only cover the private sector. We have the issue in affordability. We have the issue in availability. We have the issue of developing countries, especially like the Philippines, that's not a Gavi country anymore. And there's PAHO restriction in terms of pricing. How can we entice governments to invest? But at the same time, how do we allow the stakeholders to realize that immunization is not just for those who can afford it, because it's not selective protectiveness. Herd immunity is actually the core and the basic important aspect why we are pushing for vaccination. And so who are the real stakeholders? I believe it's the same through many of our countries. It's the Ministry of Health, the Ministry of Budget and Management, the President and the Parliament, and the civil society and the NGOs. I was listening to the two presentations earlier, HPV. When I started the introduction of HPV, sometime of, I think, early last year, it's the same thing. There was a lot of objection on the religious aspect. I think what complicated the matter was that they see me not as a minister of health, but as a former legislator who actively pushed for the passage of the reproductive health law. So for the past 9 years, I was pushing for that law, and before I left Congress and joined the Ministry of Health, I was somehow the face of reproductive health. And so the church was up there, oh, this is a technique. From Congress, from the Parliament, she is being placed into the Ministry of Health. Because again, it's a part of reproductive health, and children might be promiscuous because it was part of a school-based campaign. But what I had as a strength during the time, and what we had as a strength, because it involved HPV, was the fact that there are a lot of civil societies and NGOs involved in reproductive health. So they were speaking up. There was noise on the grounds. There were people and cancer patients standing up and saying, look, we don't want this to happen to our children. And cervical cancer has somehow been tainted as a disease that's being discriminated because it will always be linked to multiple sexual partners or early age of first sexual onset. We were able to implement it, but we had to take it out of the school because the Ministry of Education didn't want to take the risk of implementing it in a school-based program and then later on having himself answerable to the church who has been persistently objecting to that kind of vaccine. But basically, if we look at the bigger picture, the biggest problem is the fact that most of the discussions on the public health value of vaccine is contained within the ministries of health. It's contained within the program. It's contained within our experts. It's contained within a few groups dedicated and working and pushing for research. And we sometimes forget that the world has changed. And decisions are made, not often, but sometimes, not because of the rationality behind the program, but because of the big noise in social media. Just a mere person saying, oh, my child was vaccinated with HPV and then she got pregnant at 17 and then she has another child at 19. Now she has 4 children. She wasn't able to go to college. It destroys. Like we had mayors and governors thinking twice. And mind you, the HPV vaccination that the Philippines entered into was mainly focused on the 20 poorest provinces with high incidence of cervical cancer. There is also another problem, because when we go to Parliament for funding, when we go to the Ministry of Budget and Management, their impression of immunization is actually protection, that's right, but they also forget that there are booster doses needed. They sometimes forget that in immunization programs, because it's a public health program, it's similar to other health programs that something might happen that is not directly related to the vaccine. So somebody getting pregnant at an early age can be attributed to the vaccine. Somebody dying or somebody having a heart condition can be misinterpreted as an allergy because before she died, the patient was bloated. Things like this can easily be answered among experts. But once it gets to some NGOs, or to some people whose interest is advocacy. Of course, we're talking about public funds. And in public funds, there are a lot of proposals. Aid and donors, since climate change, have begun to slow down. And developed countries, when they send money to developing countries, has started with the problems on migration, with the problems on climate change, with the problems on terrorism, priorities has changed. Advocacies started to have a little share in donors and health partners' money. And that is why all the advocacy groups are now going back to their respective governments, saying that counseling and advocacy should get a huge chunk, and health education should be a priority. And there is now a competition between spending for advocacy or new vaccines, especially if the vaccine is costly. And the drivers for public program funding. I am sorry to say this, but when I was in Parliament, I never realized that. But when I transferred to the executive, and as I was observing also other countries who were investing, because there's the politics of decision-making, it's sometimes difficult to admit that the rationale of public program fundings can sometimes be a knee-jerk reaction. If there's an outbreak or if there's an epidemic, if there are a lot of people having dengue, there is massive procurement of insecticides, larvicides, and massive campaign on cleanliness, forgetting the fact that the population of mosquitoes is a lot bigger than the population of humans. and forgetting the fact that when we do proceed with advocacies and counseling, we should look at long-term solutions. And vaccination is actually a very important aspect. It's just that we don't have the loud voice because most of the experts are focused on research, are focused on working, and are focused on addressing new infectious diseases. And when there is public clamor, that becomes a priority of the government. When the public clamor gets lost, let's say for Zika, that has been getting the interest of the public now because of microcephaly, a baby with a small head, is a very graphic call for public funding. But let's say in the years to come, when the Zika vaccine will already be available, and people forget about the cases of microcephaly, I am not sure if governments will still invest on the Zika vaccine. And this is actually a problem that is starting to creep into the public health program. We all know that the real rationale of vaccination is the prevention of vaccine-preventable diseases. But decisions on funding is not made by vaccination experts. Decision on funding is made by people who are dependent on the information being fed to them. And almost always, the advisors that surround them would focus on which programs are immediately, and I'm giving emphasis on the word immediately appreciated by the people. I started to ask myself, are the people aware of the benefits of vaccination? So when I stepped out of the office and I was trying to make some visitations with the provinces and the villages, I would ask a mother in the school, oh, how are you? Did you receive a vaccine? And said, yes. So it gives me pride. Here's a family that, it's part of legacy that you're living as part of the government. But I was surprised when I asked her, and I said, why? Why did you have your child vaccinated? Well, because it's free. And then I asked another parent in the other island. Mind you, 9 out of 10 said they have their children vaccinated because it's free. So are we missing the big stakeholder? And that's actually noise from the public because they don't feel it unless somebody gets infected. So what happens is that there would sometimes be exhaustion of human resource. Like if the dengue vaccine is now there, or even if rotavirus vaccine is there, unless there's an outbreak, because we had 2 outbreaks of diarrhea in Zamboanga, that's the southern part of the Philippines. And the other area wherein Haiyan, Typhoon Haiyan hit, that's the central part of the Visayas, it's like 2 provinces. That was only when I had to start discussing that here is rotavirus, that if we have had our children vaccinated, then we could not have had those deaths because rotavirus was isolated. See, there's now a challenge. Like when we were trying to implement the human papillomavirus vaccination program, people who would insist on HTA, which I believe is also good, but there are some advocates who would say those in the academe who are inside the classrooms but who do not see the situation on the grounds will say, but we have to establish the real burden of cervical cancer. And so we have to do VIA for all women. But when you look at the cost is even bigger than cervical cancer than vaccination. So there is the issue, the challenge now is that how do we tackle all of this? And we now go back. Do we have to orient our mayors, our governors, the non-doctors? Because in a public program, the impact to public health is sometimes difficult to explain, especially if it comes after a few generations. They would always look at what is happening during the time. And almost always, the program that they would look into is hospitalization. But of course, again, that's exhaustion of human resource. Talking about anti-vaccine groups versus experts. The workload usually of the anti-vaccine groups is lesser because theirs is to just make the noise. While the experts are doing research, catering to patients, doing other public health programs, and at the same time studying and looking for solutions to new challenges in the aspect of health. But the noise of the anti-vaccine groups, because they have been through many advocacies, is usually bigger and stronger. And it also has something to do with personalities. The experts on vaccination, as I've observed, are more reserved and conservative. They would speak, they would give the reason, but they would not go deeper and pursue a debate because they would find it a waste of time. But the consequence is that the anti-vaccine group inculcates wrong information, not only on the general public, but the children as well, who are very vulnerable to what they see in the social media. As I was in the plane, I got hold of this article that was recently published that Stanford made a study among professionals, the millennials, the older generation, across all categories and social classes, who can decipher a real news from a false news in social media. And the answer was, even professionals, only 2 out of 10 can really decipher a real news versus a not so real news. And for developing countries with huge out-of-pocket expenditure, the general public is dependent on the government. Let me just cite an example on the progress towards measles elimination. This happened sometime in the latter part of 2013, when there was, of course, misinformation again, because a campaign on autism was started by the World Health Organization, and there are a lot of civil societies and NGOs campaigning for attention on autism. And in fact, my successor decided to coin it with mental health. So it is gaining a huge importance. And when an information came out that autism is related to the second dose of measles, the second, if you see this graph, the coverage is quite high for the measles-only virus, measles-only vaccine, for the measles-containing vaccine. But for MMR, which was given at 9 months old, the compliance was very low. And coupled with a very small religious sector in the central part of the Visayas that does not believe in vaccination, this paved way for a measles outbreak in the Philippines. And it spread, even affecting those who have been vaccinated. In other words, the 15% danger of not having a second dose of measles vaccine paved way into an outbreak. And what was difficult was that there was also an outbreak. I'm not sure, I think it was Australia in Darwin. There was an outbreak of measles in that area of the world. And there were also pockets of measles in China and then the US. And when the World Health Organization traced it, it all came from the Philippines because one of the dance troupe of the Philippines was invited to Australia. One of the dancers, these were school-age children who are talented in arts and sciences. And then one of them had measles. They infected the other school children in Australia, and then it went so on and on. In other words, viruses don't consider borders. And vaccination is an advocacy and a program that should be addressed not only by a specific country, but by the whole world. Tetanus toxoid immunization, I was hearing from our colleague in Malaysia and then in Indonesia, how the religious sector has been objecting to this. And that's why it's very important to have the school-based immunization where TD is included. Sometime in the 1980s, the Supreme Court of the Philippines decided to stop the tetanus toxoid vaccination among pregnant mothers, believing in the case file that it is an abortion, it would cause, it is an abortifacient. After 5 and later on 10 years, the incidence of neonatal tetanus was so high, children were dying. And that prompted the Supreme Court to lift that order and put back tetanus toxoid immunization among pregnant mothers. The question is, who takes the accountability for the wrong information? Will we be able to reverse the lives that has been lost because of poor information? It's sad to say that we have a lot of scientists, researchers dedicated to find vaccines for vaccine-preventable diseases, but there will always be nuances. And the victim are not the health workers, are not the scientists, not the researchers, not the vaccine experts, not even the oppositors. The victim is the public, especially those on the lower socioeconomic bracket who believed in wrong information. Now comes dengue vaccination in the Philippines. Why did we decide to start it? First, because there was an infusion in budget, and the Philippines has a very high incidence of dengue. And we don't take pride of it, but it's part of the name because dengue before was called Philippine hemorrhagic fever because it was discovered in the Philippines. Bottom line is there's a lot of dengue viruses out there in our country. But because it was placed in the program, the others were now saying, why don't we just use it for breastfeeding? Why don't we use it for advocacies? Why don't we use it for counseling? So much so that when the shifted administration came, the new Minister of Health made a decision to just say, okay, so that we can discuss it, let me stop the program first. And maybe it was not the intention, maybe she did not expect that it will be a big problem. She allowed one of those very vocal against vaccination to be part of the dengue expert panel. But then, of course, it did not progress, so he had to be removed because people was questioning his interest and his credentials. But then the damage has been done. He was able to go out and say, I'm part of the technical working group. I saw children dying. I saw a lot of complications. I'm afraid that instead of protecting them from dengue, they will instead have severe dengue in the future. And he would use all those medical terminologies and technicalities. Of course, parents, the mere word, the single word of fear of a complication for their children will actually get out of the program, forgetting that viruses are actually now the new exports. So these are just a few but the situations wherein a long program that has been planned by many people will crumble because experts are not so noisy and our voice is not so loud to counter those who are sowing misinformation. There is therefore a need for strategies to increase immunization levels, as what we have seen in many of the situations in our country. And what are the action points that we have learned? In the few years, in the 21 years that I've been with government, we have always realized that private availability and public availability of vaccines differs in several aspects, especially the time lag between availability. And this has set some sort of an attitude in each country, wherein it is always expected that it will be available for those who can afford it, but then public funding would take time. That is understandable. But maybe the World Health Organization, or how do we work it out, that there should be a maximum time lag between availability to the private sector and the public sector. And I don't know if this will also entail reduction in prices, if possible. Why? Because if it's only given to the private sector, the herd immunity that we are trying to achieve, maximizing the innovations in vaccination, will be very difficult. There is also a need for general public understanding vaccination benefits. When I started talking to them about a very famous governor in the Philippines, and they thought that she was just limping because she grew up with a shorter leg than the other one, and I told them that's polio. And then when somebody died who was very famous and it turned out to be dengue and they thought it was Guillain-Barré syndrome, then it gets the attention of people. I think, and I personally believe, that immunization, its history, the diseases that has been eradicated, why we have reached this era, and why research should be needed, should be incorporated in the curricula among school children. So that when they grow up as parents, they bring with them that knowledge and that information that vaccination will save the lives of their children. We have been talking about going to the islands, going to the provinces. Yes, it's true. It's very difficult to bring them, especially if it's not that convenient for the parents. But if they will learn from school age until they grow older that vaccination has actually saved a lot of diseases, then they will surely realize the importance of it. Because out of this point of time, many parents would hear about vaccination once they are pregnant already. And all they know is that it's an injection. They can't even decipher that BCG is for TB. I decided to have a survey when I was the Minister of Health, and it's very difficult for parents to remember this vaccine was for what. DPT is for what, Penta is for what. So we just tell them to count. Your child should have at least this number of drops and this number of injections by age 1. By grade 1, it should be this number of injections. So that's how they memorize it. But general public understanding should start as early as it could be given. And there should also be education to counter the myths, because it's a recycled misinformation. I've heard it when I was still 18 years old. I've heard it again when I was already in Congress, and it keeps coming back. And mind you, it still becomes effective because some just heard of it during that time that it was introduced again. Because if there will be exhaustion among government workers, let's say, for instance, when we had this school-based immunization and measles, rubella, tetanus, MRTD, one of those injected suddenly became very sick after 3 days, 2 or 3 days, and she was rushed to the hospital, intubated, brought into the ICU. It was early morning that I went to that private hospital because deep in my heart, I know it was not because of the vaccines, but you had a very furious parents. And that child, the parents worked for a reputable media personality who was already talking and who was angry about the school-based immunization because he thought that paved way for the illness of the child. And we had to go and explore all means, had her transferred. She's now okay. She's being rehabilitated. She still can't walk. But we were really out there to prove that it was not the school-based immunization program. We initially thought it was Guillain-Barré syndrome, but it was not. And we looked for other autoimmune diseases. It was all negative. And one of the doctors said, why don't we try dengue? She turned out positive for dengue antibodies and dengue antigen. So she had a previous infection, and it was a second dengue infection, but she also had pneumonia. So we really do not know if it was because of the pneumonia or was it dengue, but the patient developed transverse myelitis. And that was the cause of her weakness, and that was the cause that pushed her to the ICU. But if we were not that passionate to disprove the myth that it was because of the school-based vaccination, the teachers and the health workers would end up having cases. And that's what I'm referring to, the exhaustion among government workers. Why? Because if there's nobody protecting them among all this misinformation, and they would be accused of sending or causing the life of a child, then it's very difficult. During the dengue vaccination program, there was an 11-year-old child whose father died and his mother had another family. So that child from the other part of the country had to be sent to Luzon, the northern part of the country, to a relative. He was not well taken care of. Like a year before he was sent to that school, he always feels weak. And so the guardians was always advised to bring that child to a specialist so that he can be checked. It never happened for more than a year. When he was vaccinated with dengue, after 3 or 4 days or even 5 days, the patient had diarrhea. It was amoebiasis. Again, he was just at home, not being rehydrated. He developed pneumonia. And later on, when he was having edema, he was brought to the hospital. He was ultimately diagnosed with a congestive heart failure. His murmurs was grade 4/5. He had severe pneumonia. He was extremely dehydrated. Unfortunately, the child died. And now, because of the misinformation and because of some groups calling that vaccination budget should instead be spent on advocacies and counseling, on other public health programs, on medications. But actually, there was a huge increase in those similar programs. It was not only vaccination. That paved way for the health workers. And that's why instead of flying here the other day, I had to stay to attend to a Senate investigation because one of the senators was getting hold of this child, of the guardians, and then allowing the guardians to speak that their child was vaccinated despite the fact that he was sick. But mind you, the guardians was not actually taking care of the child. So this gives exhaustion to the EPI program manager. This gives exhaustion to the vaccinators, especially when in the news you can see statements of senators blaming health workers and telling him it's your obligation to check the child from head to toe before vaccinating them. So it's a situation that sometimes cripples government workers because instead of being passionate, they would just refrain from working. Anyway, they would still be receiving the same salary and the same retirement. But this is something that we should not allow because we are not only health workers. We have given that opportunity and that knowledge to make a difference. And that is why we are again here today exchanging notes. And people asked me, why did I push for a huge increase in the immunization budget during my stint? Even before assuming the post, when I was still in Congress and when I was still an undersecretary, a deputy minister of the Ministry of Health, I saw the president who has always been talking of public health. He is a president who has had nephews and nieces. He is a president who is well-traveled. He is a president who saw the problems in Africa. He is a president who he is fond of reading. He is fond of reading about illnesses that were eliminated. And one time there was a movie about this hero in the Philippines I was saying all about, and many children were asking, why can he be a hero when he was in a wheelchair? And the president called me up and asked me, why was he in a wheelchair? And I said, Mr. President, he was a victim of poliomyelitis, and he was surprised. And then I told him, like, that's why we have to fund the shift to IPV, because, and he said, why did we opt for OPV? Simply because it's cheaper. And I told him it does not necessarily mean that when it's cheaper, it's safer. And he said, how much does it cost? And then I gave him the figure. And he asked me, who else has polio in the Philippines? And I told him the governor of this province and this, the other advocate on this side. And here is a president who was thinking of long-term programs. He does not want dole-outs. He does not want medical missions. He wanted universal health care, a good health insurance. He wanted maintenance medications for those who cannot afford. He wanted jobs. And he also wanted elimination of illnesses. He has this belief that we should invest more on prevention rather than a curative health care. And that was why we had to push and defend the school-based immunization, the cervical cancer vaccination, and then the dengue vaccination program, because they knew that you seldom find a president who understands that investing in vaccination is a long-term shot, but it's for the people. And true enough, that paved way for the immunization budget of the Philippines to be pegged at around, in pesos, more or less 7 million. Because almost always, I tell them that vaccination is a government's obligation. It's every citizen's right. So we cannot just say it has to be given by the private practitioners, or it can be availed of by the public at the time that the government decides on it. It should actually be pushed. And as I end my talk, allow me to say that when I looked at doctors in Congress, many are not updated in what is happening. So I think it's best that given the opportunity, we now have to think about supporting organizations, supporting advocates, teaching schools, teaching parents, allowing it as a part of a curriculum, and making senators, congressmen aware of how is it to invest on immunization program. Thank you very much, and good afternoon.